The pillar procedure is an effective first-line treatment for the palatal component of sleep-disordered breathing, including snoring and obstructive sleep apnea, commonly referred to as OSA. It is designed to produce a lasting effect without surgically removing or damaging tissue. First, let's examine how the palate can cause or contribute to snoring and sleep apnea. Airflow through passages at the back of the mouth and throat creates instability in soft palate tissue, causing these tissues to vibrate. This vibration results in snoring sounds. In the case of sleep apnea, the airway is blocked when the soft tissue, like the palate, collapses and blocks the airway during sleep. The soft palate plays a significant role in both snoring and sleep apnea. The patented pillar procedure provides a simple, innovative approach to treating the soft palate component of sleep-disordered breathing without an aggressive surgical procedure. The pillar procedure works by stiffening palate tissue to reduce both the vibration that causes snoring and the ability of the soft palate to obstruct the airway. Placing 3 tiny inserts, each less than an inch long, in the soft palate, the pillar procedure is a simple process for both snoring and OSA patients. The procedure takes only a single brief office visit using a local anesthetic to quickly insert the pillar product with minimal discomfort and far less recovery time than more invasive procedures. Most patients can resume normal diet and activities the same day. As air passes over the palate, the stiffening effect created by the pillar procedure reduces soft palate vibration and obstruction for as long as the inserts are in place. Made of a material used in medical devices for many years, pillar inserts are designed to be invisible and should not be felt or interfere with swallowing or speech after placement. Studies estimate that many snoring and sleep apnea sufferers have a soft palate component that contributes to their condition. Pillar inserts stiffen the soft palate, much like struts stiffen and add stability to an airplane wing. Here is a cross-sectional view of the pillar product at insertion. Over time, a tissue capsule forms around the inserts, adding rigidity. This natural tissue response increases the structural integrity of the soft palate, further reducing vibration that can cause or contribute to snoring and the obstructions that cause sleep apnea. Most patients soon report a noticeable lasting reduction in snoring, and most patients with sleep apnea may see the number of sleep apnea events diminish significantly.
The tongue-based suspension may be performed with or without Airvance hyoid suspension. This procedure may be performed intraorally or alternatively through a submental incision. This video will demonstrate the submental approach. After normal prep and drape, an incision is made beneath the chin, approximately 1 inch beneath the inferior rim of the mandible and approximately 1 inch in length. Blunt dissection is performed up to the screw insertion point on or beneath the genial tubercle. The Airvance bone screw inserter is placed in the incision at the level of the genial tubercle. The miniature screw with attached sutures is implanted into the back of the mandible in a manner that the patient will be unable to feel. The Airvance suture passer with attached temporary loop suture is passed from the chin incision to one side of the base of tongue, exiting 1 centimeter off midline on or behind the circumvalley papillae. The temporary loop suture is freed from the suture passer extending from the base of tongue. One of the permanent suture tails is loaded into the suture passer. The suture passer is then placed into the incision and passed to the contralateral base of tongue. The suture is retrieved with forceps and the suture passer withdrawn. The permanent suture is loaded onto a free curved needle in a manner that will not damage the usable part of the suspension suture. The needle is buried at the base of tongue, passed from one exit hole to the other. The pass must be superficial, approximately 2 millimeters deep. This ensures that the cross-stitch is anchored into the leathery tissues inherent at the base of tongue. Over time, fibrosis will form around the foreign body suture, further strengthening the long-term support of the hammock stitch. The permanent suture is threaded through the temporary loop until the loop can be pulled or advanced forward through the submental incision. This internalizes and triangulates the permanent suture within the tongue. Grasping the tail of the internalized suture, the surgeon places his or her free hand at the base of tongue and gently pulls on the suture, feeling for a dramatic tension band and a slight midline dimple. Proper suspension is a key element of this procedure, ensuring that the patient does not feel the permanent suture during waking hours. The objective of the procedure is to create a hammock or suspension at the base of tongue, eliminating backwards collapse of the tongue during sleep. A surgeon's knot is placed and the knot worked into the incision. Holding the suture tails to steady tension, the surgeon palpates the base of tongue, confirming the tension band and small midline dimple as previously described. When the surgeon is satisfied with the suspension or hammock, a single knot is added over the surgeon's knot, effectively locking and completing the procedure. A series of reversing half-hitch knots are added, the suture tails are cut, and the incision closed with sutures and dressing of choice. Medtronic ENT maintains a staff of clinical trainers who will attend your early Airvance bone screw system surgeries to impart technique-specific suggestions that can help reduce your overall learning curve and procedure time.